Hello. This is class 27 of our series, Public Health Emergency Planning. Something different, and we're turning the corner still. Growing together. Emergency planning guidance. Health issues that may impact our community. Different levels of diseases and how the community can be impacted. Another way of saying it. An epidemic. Let's start there. What is it? Glad you asked. A widespread occurrence of an infectious disease in a community at a time, i.e., measles, flu, and COVID-19 epidemic. It spreads quickly and affects many. Measles is extremely contagious, spreading through airborne particles that can remain in the air for hours. Measles is extremely contagious. Now, influenza, is contagious as well and is spread through respiratory droplets that are released when an infected person coughs, sneezes, or talks. The virus can also be spread by touching contaminated surfaces and then touching your eyes, nose, or mouth. People are most contagious in the first few days after they become sick. They can remain contagious for up to 7 days. After their symptoms start, it's important to stay home and avoid contact with others. Why? To prevent spreading it to others according to the CDC, the Center for Disease Control. COVID-19 is less infectious than measles, though its transmissibility can vary depending on the specific variant of it, vaccination status, and other factors. B. Pandemic. A disease prevalent over a whole country or the world. A pandemic occurs over a wide geographic area and affects a high proportion of a population. Over a wide geographic area and affects a high proportion of our population. C. Global epidemic. An epidemic that spreads to more than one continent. How is an epidemic different from a pandemic? Well, a pandemic is a bigger epidemic. There is a minor difference between an epidemic and a pandemic. An epidemic is where there are numerous breakouts of a single disease. A pandemic is when the disease starts to spread on a larger scale than an epidemic. A pandemic is essentially a bigger epidemic. Endemic, D. You may not have heard this one, so it's endemic. A disease that is constantly present in people of a certain class or in people living in a particular location. For an example, endemic disease and diseases are malaria, hepatitis B, in parenthesis, HBV infection, and HIV epidemic is starting to be under control in large parts of Africa. That's good news. Common sources of outbreaks. The Center for Disease Control, the CDC, separates outbreaks of diseases by the source. Classification. A pandemic flu or influenza is a respiratory virus that spreads easily from person to person through coughing and sneezing. It can cause mild to severe illness, including death. A pandemic flu is caused by a virus that is new to the population or has not circulated recently and widely in the human population, or has not circulated or become, well, I'll put it this way. I'll repeat it. While not all people will become infected during a pandemic, nearly all people are susceptible to the infection. Various diseases has regularly appeared which resulted in a widespread community illness, disruption, and death. The Spanish flu of 1918 infected between 25 to 30% of the world's population and killed an estimated 40 to 50 people. The last pandemic was 2009 H1N1 influenza epidemic, and neither SARS, S-A-R-S, MERS, M-E-R-S, nor Ebola qualified as a pandemic, despite of differing severity, case counts, and death rates. HIV/AIDS, we all remember that one, is an example of one of the most destructive global pandemics in history. The most recent is COVID-19 from 2019 through 2020, a worldwide pandemic. Communicable diseases or propagated outbreaks, PROPAGATED outbreaks, are infectious diseases which spread from person to person or from animals to people, which include salmonella, coronavirus, COVID-19, that originated in Wuhan, W-U-H-A-N, China, in 2019, i.e. sharing needles cause, or in some cases, Lyme diseases or deer ticks. Foodborne, waterborne illnesses, disease outbreaks, can come from a common source. For instance, a group of people with food poisoning all ate at the same restaurant. While common, this is preventable public health problem. It's preventable. And each year, 1 in 6 Americans get sick consuming contaminated foods and beverages. There are many diseases causing substance, microbe, pathogens, chemicals, and other substances that can cause food-borne disease or illness, including salmonella and staphylococcus, or staph infection. Why immunizations are important to some people, but not others. It's a matter of opinion. An immunization is a vaccine, a shot, or a set of shots. They are administered to children at different ages to help or keep them from developing dangerous and debilitating childhood diseases. Pertussis, whooping cough, polio, measles, chickenpox, and tetanus. They are effective in preventing diseases. Non-pharmaceutical interventions, or in parentheses, NPIs, to reduce risk. You can always play this video over. NPIs are actions apart from getting vaccinated and taking medications. Community spread virus is often a trigger to begin implementing new strategies tailored to the needs of a local of a local circumstance, put it that way. The goal is to blunt the impact of disease and slow the spread of the virus. There are practical measures, interventions that can help limit exposure by reducing face-to-face contact in community settings. 1. For schools, options include dividing students into smaller groups or in severe pandemic outbreaks, closing schools and using internet-based teleschooling to continue education. Hopefully, we are in 2025 and families do have Wi-Fi, especially in rural areas. That is our hope. 2, for adults, businesses can replace in-person meetings with video or telephone conferences and increase teleworking options. 3, on a large scale, communities and cities may need to modify, postpone, or cancel mass gatherings. 4, individuals should stay at home when they are sick. 5, immunizations are safe and effective, a way to gain protection against various communicable diseases. 6, hand washing, often using soap, hand sanitizer with proven techniques. 7, keep surfaces clean and using disinfectant. And I'm going to add 8, wear masks. Some people prefer them, some do not. So this is news you can use. So let's go on. You want a little history? Okay. Texas measles outbreak. According to Johns Hopkins Bloomberg School of Public Health, the 2025 measles outbreak in Texas began in Gaines County, Texas, a rural area in West Texas with cases concentrated in a Mennonite community that has low vaccination rates. Many of the children are homeschooled, attend smaller private schools, and many are unvaccinated. The outbreaks started in late January of 2025 and quickly spread to surrounding counties and neighboring states. This community has very low rates of measles vaccination, which allowed the highly contagious virus to spread easily from Gaines County. The outbreak spread to other counties, according to the New Mexico School of Public Health. And it spread across the border into New Mexico. Measles was considered eliminated in the United States in 2000, thanks to the highly effective MMR vaccine and high vaccination rates too. But because measles is so contagious, at least 95% of a community must be vaccinated to prevent outbreaks, says Bill Moss, MD, Master's in Public Health, a professor in epidemiology and executive director of the International Vaccine Access Center. The Texas Tribune, hate it when I do that. The Texas Tribune data reporter Dan Kemahill in October 13, 2025, he reported that more Texas kindergartners were coming to school without measles vaccination proof of exemptions in school districts and charter network, with the most vaccine delinquencies. As many as 44% of the kindergartners were not compliant with state requirements. Timeline. From January 2025 through April 2025, the outbreak reached its peak with over 700 cases reported in May of 2025. The number of new cases began to decline by August, and the outbreak was declared over with no new cases reported for more than 42 days. That was the criteria. Impact. While cases reached 700 hospitalizations and were over 100 people and 2 deaths were reported as a result of the outbreak, the vaccination status in the majority of the cases, over 90%, were people who were not vaccinated or had only received 1 dose of the measles vaccine. The best preventive measures to get vaccinated is with 2 doses of the MMR, measles, mumps, rubella vaccine. That is the best treatment. The science reports vaccination is highly effective, preventing more than 97% of measles cases. Additional data. I've done the research for you. U.S. measles cases across the county and country. Maria Godoy, reporter for NPR National Public Radio on October 15, 2025, nearly 2 months after a deadly massive measles outbreak in Texas, it was declared over the highly contagious disease continues to spread across the country. The United States has confirmed 1,596 cases this year. According to the Centers for Disease Control and Prevention, this is the highest annual number in more than 3 decades. But the true total could be even higher, says Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He states if you talk to people on the ground, including not only in Texas, but other states, they all say the same thing, which is that the number are much worse than that, probably closer to 5,000 cases, he says, and it's not done. The current outbreak in South Carolina, where 139 school children at 2 schools are now subject to a 21-day quarantine after being exposed to measles. The State Department of Public Health on Tuesday reported its 16th measles case since July of 2025, including 12 cases directly linked to an ongoing outbreak in Spartanburg County. Dr. Linda Bell, South Carolina's state epidemiologist, told reporters during a briefing last week there is an active, unrecognized community transmission of measles occurring, she said, that makes it vital that people and the public receive recommended measles vaccine. She recommends it. There is a large measles outbreak along the border area of Arizona. Southwestern Utah continues to grow, with Utah now reporting 56 cases. This year, as of Tuesday, nearly all of the cases occurred in people who were unvaccinated. 6 people required hospitalization, according to Utah Department of Health and Human Services. Wastewater testing shows that the measles virus is more widespread in the United States than previously known. In neighboring Arizona, officials have reported 77 cases so far this year as of Tuesday, including 14 new cases since last week. In Minnesota, Officials last week reported a recent surge of 20 cases. All told, the CDC has confirmed 44 measles outbreaks in 41 states this year. The CDC defines an outbreak as 3 or more cases that are linked, and the vast majority of cases were in people who were unvaccinated. 27% have been children under the age of 5. About 1 in 8 measles cases have resulted in hospitalization. Widespread vaccination in the United States has saved hundreds of lives each year. In addition, measles is one of the most contagious diseases known to humans. On an average, an infected person will infect as many as 18 other unvaccinated people per people. A person with measles can emit infectious particles that linger in the air for up to 2 hours long after they have left the room. That's why it's so highly transmittable. Before widespread vaccination, pretty much everyone got measles in childhood, and 400 to 500 people in the United States used to die from it each year. The disease was declared eliminated in the United States in FY 2000. To protect communities against outbreaks, they need vaccination rates of 95%. According to the CDC, nationwide measles vaccination rates have been slipping for years. They are currently at 92.5%. Please don't shoot the messenger. I did the research. I'm the messenger. I have shared this with you to keep you informed, and hopefully you will make decisions for you and your family. You have to make those decisions. This is news that you can use. I will see you next Friday. You know where to reach me. You know how to email me. Prepare before it happens at outlook.com. Send me an email. We can talk more about this. We can do consultations. Whatever you need, let me know. Don't forget, I have an ebook out there, a paperback, and a hardback. The ebook's only $10. Yeah. So, I will see you soon. Thanks for coming on. Don't forget to like. Don't forget to like this video. I would appreciate it. And subscribe. Thank you.